I don't think guys like to talk around, walk around saying, geez, I can't get it up.
Just stating that out loud, I'm really glad that we're doing this discussion. And it's my hope that someone who's maybe less comfortable at the end of our chit chat is more comfortable.
I think anybody who is thinking, don't want to talk about sex, you got to remember, how did you get here? Now, none of us like to think about our parents doing it, but the fact is, they must have done it at least once, which is why we're here. Can you tell us broadly how the sexual issues that MS can bring for men and women?
The first thing I want to say is that it's a very common phenomenon. And so I would submit that the majority of people impacted by MS at some point might experience some challenges in the bedroom. It's something that's common, and yet we're embarrassed about it. And that's a problem. When we think about women, I like to divide the act of intercourse into three sections, if you will. There's arousal, there's lubrication, and there's orgasm. And there's actually different physiological steps involved in each. And each one could be affected. So someone, for example, might have difficulty with libido, with arousal. They're just not interested. But if they engage in intercourse, lubrication and orgasm are okay. Conversely, there are people that are terribly excited to have sex. They have adequate lubrication and cannot orgasm to save the Pope. And so I like to divide it into those categories. Men have very similar phases of sex, if you will. There's an arousal phase. The male equivalent to lubrication is erection, and then the ability to achieve orgasm. And so oftentimes we'll get a little bit more granular. So we think about with gentlemen, arousal, obtaining an erection, maintaining an erection adequate for penetration, and then ejaculation. And so when I'm talking to a family about challenges in the bedroom, I oftentimes divide my thoughts into those categories because it helps us get down to the problem pretty quickly.
Everyone jokes about some things. I'm going to show you something. This is a test, yeah?
Okay.
What's that?
A little blue pill.
And what's that?
The first one is sildenafil. All right. So Viagra.
People know it as Viagra, yeah?
Yeah, the second one, if we use trade names, is probably Cialis, the yellow one. Yep.
Exactly, yeah. And in the UK, it's tadalafil. But just to let people know, my GP did not bat an eyelid. Now, I'm 53, and I just said to him, occasionally, you're all good to go, you're hot to trot, you're in the middle of the job, and then certain parts go, I'm not playing anymore. And that it's really, really helpful for that. It doesn't make you better at sex. It doesn't make anything like that. It just enables you to, A, essentially get an erection, and then B, it doesn't go away until you're done.
It recreates some appropriate physiology, and it can make a really, really big difference. And it's a very easy way to help with erectile dysfunction. Maybe what we could do in the spirit of this is talk about interventions at each one of those different time points for both men and women. So we'll start with gentlemen. So if we start with arousal, that's not going to be treated by a Viagra or Cialis. Arousal is a lot of physiologic stuff, but it's also a lot of psychological stuff. And oftentimes, if somebody with MS has difficulty with arousal, male or female, we look at their mood. We look at depression and anxiety. When you are sad, blue, and depressed, you experience a symptom sometimes called anhedonia, which means things that I enjoy, I don't enjoy very much anymore. That could be television, that could be sex, that could be conversation, it could be a lot of things. But speaking about sex and about arousal, I want us to think more broadly about mood in general. And the difficulty with arousal might be a tip-off that we're actually dealing with untreated or undertreated depression. I see it all the time. You deal with male erectile function, and here we have a very, very common problem. And a very common solution is what you just held up. So we can take a pill for that ill. Some gentlemen, those pills are inadequate, and we can use actually an older technology. There are these shots that you take on the side of the penis. Well, these intracavernosus injections, which sound barbaric but are extremely effective. And there's also pumps. You give an example. There's innumerable ways of trying to assist with erectile function. If those don't work, urologists can actually do implants, like penile implants. And some are fixed and rigid, and some are inflatable and not. And so when a gentleman tells me I'm having trouble getting an erection, I oftentimes say, how serious are you about an erection? Because we could take you all the way to the operating room if we must. Now, dealing with ejaculation is a whole nother set of equations, and there isn't a fancy drug to assist with that. And sometimes if we can't achieve orgasm, then we can do a couple tricks, and I'll share just one with you right now. It works for men and women. Sometimes the problem in achieving orgasm is having adequate information sent from the down theres to the up theres. Let me explain. Right now, I'm using my indoor voice. There's not a lot of ambient noise, and your speaker is set up just fine, and so there's not a lot of interference. I'm just talking at a normal pace. If my team members in my clinic all piled into this room while we were talking, I would start screaming. I would have to provide overdrive stimulation to get to your ears. In a similar fashion, so when there's damage to the spinal cord or brain from multiple sclerosis and the down theres are stimulated, the message going up the spinal cord can literally die on the way. So the brain never learns what's going on down there, and it never learns what's supposed to be happening.
So it's a happy party and the brain's not invited.
Exactly. And so one solution is not a pill, but actually a vibrator. So a plug in the wall vibrator, like a Hitachi magic wand, with like DC power, this kind of device provides overdrive stimulation. And remember, we're still talking about gentlemen. You apply that on the head of the glans penis, on the shaft of the penis, under the testicles, and it can provide enough overdrive stimulation to get the message up to the brain. So the brain says, oh yes, I know what we're doing now.
So it essentially breaks down into three rough areas that the clinician, you, has to look at and then sort of weight the importance of each one and then come up with the patient with potential solutions. And also, it's going to take some trying out, isn't it? I mean, you kind of got to participate in the process.
Most people impacted by MS are women. So if we talk about the same steps with women, again, we talk about arousal, and it's the same elements. And there's other elements that we have to include as well, because sometimes with women, we can see something called dysperunia. Now, this could happen with men or women, but I see it more frequently in women, where sexual sensation actually physically hurts. Or I can see spasms and spasticity of the vaginal vault, which is very painful. And so there's a couple other things that we have to contemplate when we're discussing arousal. And then we get into lubrication. Lubrication we can accomplish through a couple different means. We could use a vaginal cream, like an estrogen-laden cream, which is applied to the vulva. It does not increase estrogen in the rest of the body, so the risks of like cancers and stuff aren't increased, but it can provide local estrogen to enrich the tissues with blood flow and improve lubrication. We can use a water-based lubricant. Water-based lubricants are fantastic. They're easy to clean up, and they will just simply provide the lubrication that we don't have. As far as the orgasm piece is concerned, again, we have to look at, can we achieve orgasm? Is it really challenging? Is it an issue with communication? Is it an issue with lack of sensation? And that same vibrator trick can be very, very powerful. If there's
I spoke to a friend on my channel, so tip for day, and she talked about having to use a Hitachi wand, and she said her orgasms have changed over time from fireworks to which is, she'll still take any day.
If there's a theme running through all of this, sex does not occur in a vacuum. Sometimes, if we're lucky, it occurs with other people, and that necessitates communication. That necessitates each one of these steps works better if you're talking to your partner about it.
Talk to your doctor, and if you're not happy talking to your doctor, ask your doctor who you ought to talk to. Talk to your partner. It's absolutely key to have a fulfilling sexual life despite having MS. There's many, many ways to intervene. You can get things delivered from Amazon in a brown wrapping paper that only you need to know about, but will make a huge difference to your sex life. For more content on MS, from treatments and diagnosis to mobility and sex, subscribe to LivedHealth MS.